Hey everybody, welcome to another episode of The Bitter Pill. So, today I'm going to shift gears a little bit. I've been talking a lot about uh, overtly political topics such as the uh, failings of the squad and why Nina Turner didn't win and um, what all happened with the attacks on the Medicare for All marches. So, today I'm going to shift to more of a scientific topic, which shouldn't be political, but unfortunately has become political, and that's the topic of uh, vaccines and their efficacy and who is and isn't getting vaccinated and why or why not. Uh, so, as you may recall if you've watched this channel before, although I'm a psychologist and not an epidemiologist or virologist, I do social psychological research on COVID. Actually, I look at how cultural and ideological factors influence the way people behave and governments behave in response to the pandemic. And in that capacity, I've read a lot of the literature on COVID vaccines' efficacy and safety, and on people's reasons for taking or not taking them. And I'm hyperactive on Twitter, so I see a lot of commentary about the vaccines, and I see a lot of oversimplification uh, surrounding COVID vaccines and how they work and so forth, with people with a variety of viewpoints regarding them, ranging from hardcore anti-vaxxers to even people who are very much in favor of the vaccines. There's a bit of black and white thinking and a bit of unawareness of some of the details that it's important to be aware of in order to um, understand this very complex issue. Um, and I think we need to do our best to avoid that sort of black and white thinking or oversimplification regarding COVID and COVID vaccines. Even though the vast majority of us aren't scientific experts on viruses or vaccines, um, and the overwhelming majority of people are also not scientists in general. Uh, there are a lot of things that we can glean from just closely reading things by people who know what they're talking about. And another thing I want to talk a little bit about today is the fact that there's a lot of vilification of unvaccinated people as a group. So I want to look closely at who unvaccinated people are and just make the point that they're a diverse group. Um, and I also want to briefly look at who hardcore anti vaxxers are and what impact they're having on public discourse, although that's something that probably I won't have time to get into much today, and I'll have to save it for another episode. Uh, so, uh, and again, the title is "Pandemic of the Unvaccinated?" Question mark. So, I'm raising the question: are the claims that um, various public health officials have made and others have made that this is a quote pandemic of the unvaccinated? Is it the case that overwhelmingly people who are getting infected and transmitting COVID are people who are unvaccinated? Um, and also, what is the likelihood of people who are vaccinated getting COVID and transmitting it? And there's a growing amount of research out there on these issues, even with the advent of the Delta variant. We already understand a fair bit about what role being vaccinated or not plays in its transmission and its impact. So, one thing that uh, unfortunately, we see a lot of in our society is there's a tendency for people to perhaps not want to admit just how serious the threat posed by COVID is. People, for example, who are younger might think, well, I don't have anything to worry about. People who are getting really sick and dying are overwhelmingly older people, and I'm pretty healthy. I don't need to worry. Or they'll say things I've seen very frequently online. I see people say things like, well, COVID has a 99.9% survival rate. What are you worried about? Well, I mean, even if that were true, a 1 in 1,000 chance of dying from something is, I don't know, I'm not sure I want to take that chance, but you know, that's a impossible number because in the United States we have about 330 million people, just to take the U.S. as an example, because that's where I live, and there have been over 600,000 deaths. Now do the math on that, and you'll find that a whole lot more than 0.1% of the U.S. Population, or excuse me, a whole lot more than 1% of people who it's estimated have been infected with COVID have died. We don't know exactly how many people have been infected with, have gotten COVID. Best estimates are it's roughly 4 times as many cases as the number of cases that we've confirmed to have occurred, which is roughly 35 million in the United States times 4 gives you about 140 million. So, do the math on that, and you find that roughly 0.5% of people who are getting some type of COVID infection are dying. In any case, over 600,000 people since this pandemic began is a whole lot of people. It's an enormous number of people. And just to get away from statistics and talk about it in terms of the human details, let's take a look at some accounts of how people have been affected by this disease. So this is an interview with a doctor in Alabama who is treating lots of COVID patients these days because we've had an enormous surge over the summer in the number of cases. And that's particularly true in states like Alabama, which have comparatively low vaccination rates. I think Alabama is still below 40% fully vaccinated. So anyway, Dr. Brittany Kobia said when they interviewed her that all but one of her COVID patients in Alabama did not receive the vaccine. The vaccinated patient, she said, just needed a little oxygen and is expected to fully recover, but some of the others are dying. I'm admitting young, healthy people to the hospital with very serious COVID infections, wrote Kobia, doctor in Birmingham, Alabama, in an emotional Facebook post Sunday. One of the last things they do before they're intubated is to beg me for the vaccine. I hold their hand and then tell them, I'm sorry, but it's too late. According to Rochelle Walensky, I think is her name, the head of the U.S. CDC, the Centers for Disease Control and Prevention, COVID is a pandemic of the unvaccinated. Now, that's not literally to say that there aren't people who are vaccinated getting COVID. What she's saying is that largely it's unvaccinated people who are getting infected with COVID, and that as you look at more and more serious consequences, the percentage of unvaccinated people compared to vaccinated people goes up percent, and in Alabama, for example, 94% of hospital patients with COVID and 96% of people in Alabama who have died of COVID since this April were not fully vaccinated. So Brittany Kobias continues. A few days later, when I call time of death, I hug their family members and I tell them the best way to honor their loved one is to go get vaccinated and encourage everyone they know to do the same. They cry, they tell me they didn't know, they thought it was a hoax, meaning COVID. They thought it was political. They thought because they had a certain blood type or certain skin color, they wouldn't get as sick. They thought it was, quote, just the flu, as Trump told us for a while toward the beginning of the pandemic. But they were wrong. And they wish they could go back, but they can't. So they thank me and they go get the vaccine. And I go back to my office, write their death note, and say a small prayer that this loss will save more lives. And she talks about her experience as a doctor treating patients who overwhelmingly are not vaccinated, and when they come into the hospital. And she says you kind of go into it thinking, okay, I'm not going to feel bad for this person because they make their own choice. But then you actually see them. You see them face to face, and it really changes your whole perspective because they're still just a person that thinks that they made the best decision that they could with the information that they have and all the misinformation that's out there. And now all you really see is their fear and their regret. And even though I may walk into the room thinking, okay, this is your fault, you did this to yourself, when I leave the room, I just see a person that's really suffering and that is regretful for the choice that they made. It's important to note, I'll delve into the details a little bit later on, that obviously unvaccinated people and anti-vax people are not necessarily the same thing. First of all, children under 12, are not yet eligible to be vaccinated. So there's roughly 25 million out of the 330 million people in the United States that simply can't get vaccinated just yet. And many people are not hardcore anti-vaxxers who haven't gotten the vaccine, but they're just kind of waiting to see what other people's experience with the vaccine is. They're hesitant because they've heard, well, it's just under emergency use authorization, which, by the way, all but one of the drugs used to treat COVID patients, are also under. So, how do I know it's really been tested? How do I know it's safe, etc.? And so they hesitate to get the vaccines or get one of the vaccines, even though they may have gotten other vaccines throughout their life. And that's understandable, but that's something we need to look at more closely and look at the evidence about the safety and efficacy of the vaccine. But let's see, is there anything else I wanted to tell you here? Oh, okay. So she says, I try to be very non-judgmental when I'm getting a new COVID patient, once she's gotten past the initial impulse to be judgmental that she talked about. But I really just started asking them, why haven't you gotten the vaccine? And I'll just ask it point blank, in the least judgmental way possible, she said. And most of them, they're very honest. They give me answers. I talked to this person. I saw this thing on Facebook. I got this email. I saw this on the news. These are all the reasons that I didn't get vaccinated. And the one question that I always ask them is, did you make an appointment with your primary care doctor and ask them for their opinion on whether or not you should receive the vaccine? And so far, nobody has answered yes to that question. So She's talked to dozens of patients with COVID who come into the hospital. And they've gotten information about COVID and the vaccine from this or that person and this or that place, but the one person that none of them have asked is their doctor. It seems like that would be a logical person to ask, right? Um, you know, they're not infallible, obviously, but they do have a medical degree. They have advanced medical training, so they do have some idea of what they're talking about. And most of them are just trying to do the best they can to treat people who are sick. My dad was a doctor. I know lots of doctors. They're people who earn a very good income, but they're just regular people. They're not like big pharma or whatever it is that people tend to think of them. Well, speaking of downplaying the impact of the virus, there's one aspect of its possible effects that I hardly ever hear people talking about, but it's really important to be aware of because it's a lot more common, especially for younger people, than dying from COVID, and that's so-called long COVID. So a reporter from, I believe, CNN talked about her experience with long COVID, which is basically a situation where you've gotten infected with COVID, not necessarily even a severe case. It could have been a mild case of COVID, and then you're thinking you're gonna deal with it for a while and then get over it if you don't have a really severe case. But instead, or you may have a severe case of it, but you survive, and then you find that you're stuck with symptoms of COVID for months and months afterwards, or even you develop new symptoms out of the blue that you've never had before, and that most COVID patients don't have, and it can be really debilitating. People unable to work, unable to walk around the block without being totally out of breath, unable to think clearly or concentrate, etc. And there are various estimates about how common it is, but it really, like all of them, are that it's quite common, especially among adults, although kids do get it, and not rarely. But the estimate they gave in this article that this woman, Morgan Stevens, wrote, the estimate that she found was about 10% of people will go on after they're infected with COVID to develop long COVID, lingering symptoms post-infection that are difficult to diagnose and obviously to live with. So she talks some about her first experience with it. 4 weeks after she had contracted COVID and 2 weeks after she was no longer testing positive. And this was before vaccines were available. It was back in fall of 2020. So she said she was having body shakes, just these sort of adrenaline rushes. 2 nights earlier, what felt like a brain zap jolted me awake. I staggered into the hallway on a funhouse tilt. My world, a Salvador Dali painting, distorted and oozing. Speak, I told myself, but the words came out drowsy and slow. Despite taking precautions, my mother, father, husband, and I had contracted COVID in November, 6 months after I landed a job at CNN as a writer for CNN. Unlike many of the 181 million globally who survived coronavirus, I did not get better, and my life did not return to normal. In fact, what came next was much worse, even if it can't be detected by tests. She said, I have this shaky electric feeling in my stomach, she told the doctor. I can't think, and I can't sleep. The doctor asked if I had seen the latest 60 Minutes with Anderson Cooper on long haulers. She said, I've seen it. I work in news. And ironically, she had actually worked as a producer of a show about long COVID. And then she wound up getting it. So she had tremors and vertigo, was unable to sleep. And they didn't know what to do for her, as she put it. I was essentially charged thousands of dollars for an emergency room visit and given a prescription for Anderson Cooper, the host of a show on her own network about long COVID. When it came to long COVID, even in America's hospitals, there were no experts to be found. Today, more than 8 months later, the breakdown of my own physical and mental health has given me front row access to the long COVID crisis in a way I would never have imagined. The waves of illness have not let up, and I'm not alone. So she goes on to say, and remember, this is a person has a good job with CNN, so she's got good insurance. But she says, since December, I've seen 15 specialists, received 8 scans, visited 3 ERs, and even with insurance, spent $12,000 out of my own pocket seeking a return to normal life. Since February, I moved across the country to receive treatment from a post-COVID recovery clinic at my alma mater, University of Southern California. Let's see. Never been given a diagnosis other than post-acute COVID syndrome. I've had more than 50 symptoms ranging from cognitive impairment, insomnia, vertigo, extreme light and sound sensitivity, and fatigue to convulsive-like shaking, slurred speech, hair loss, muscle weakness, anxiety. The majority occurred simultaneously. My ability to write, writing this article, for example, marks a significant improvement. For 6 months, I couldn't do it. Still, I haven't had a symptom-free day since November 6th, the day that I tested positive for COVID, November 6, 2020. She says, in the early months, existence shrunk to survival. I was too foggy to read. I stopped watching TV, including the very news that I had worked years to be a part of. I stopped communicating with the outside world, deleted my social media accounts. They were too painful to look at. Mental health care for long haulers also cannot be a side note. The deaths of Texas Roadhouse CEO Kent Taylor and Dawson's Creek writer Heidi Farrer, both of whom committed suicide, revealed the heightened risk of suicide long COVID brings. And because imagine you've been a young, healthy, active person, then you get COVID. And then you have these symptoms that last for months and months. Some people have had it for over a year, ever since the beginning of the pandemic. And you can't do anything all of a sudden. You have trouble concentrating. You have trouble sleeping, so you're tired. You have these weird pains and physical symptoms. Just astounding number of issues. Many people have lasting lung or heart damage. It's really not something anybody would want to have, and they really don't know how to cure it at this point. I debated with myself whether to share details about my darkest moments. Often journalists may not feel comfortable sharing their struggles with mental health. Before my illness, I had never had any thoughts about suicide. This changed after I got sick. I'm no longer in this dark space, but the months that held me hostage, I inched closer to the edge than I had ever wished to be. As my brain fog intensified, I developed such a palpable anxiety, it brought with it new compulsive behaviors, such as trichotillomania or hair pulling. The days blended into one dream state. The further away I slipped from reality, the deeper my depression became. Afternoons were filled with anguish. For weeks I'd throw myself on the floor, writhe there, and bury my face in the living room rug. Maybe if I lay there long enough, I'd free myself from my body. The abrupt deterioration of my mental health from this is not unique. Many on Body Politic, and an online support group for long haulers that's helped me, shared that they too have had thoughts of ending their life. One told her, "I'm against suicide, but I told my partner to hide our gun from me," said Angela, a mother of 2 young children, who asked to keep her last name anonymous. Told her, "I didn't trust knowing where the gun was." So, that's the experiences of someone who has long COVID, and of other people that she talked to with it. It's pretty scary. So, there are a lot of people who get ill from COVID. A sizable percentage of them for a long period of time. And in the case of long COVID, the likelihood doesn't really seem to vary much with age. Younger kids seem to be a little bit less likely to be affected, but for adults, it's something like between 10 and 30% of people. So, you might get lucky if you get COVID and you have a mild case. My son had it, and his wife had it, and it was just like just like the flu for them. But that's for a lot of people, it's way more serious than that. So we're back to this issue that's the title of the of this episode. Is it pandemic of the unvaccinated? Is this a pandemic of the unvaccinated? So obviously, if you take the claim at face value, it's not true, right? Because some people who are vaccinated do get COVID. Joe Biden claimed that I like to pick on Biden a lot. Sorry, but he says a lot of stupid things. Joe Biden claimed if you're vaccinated, you won't get it, and clearly this is inaccurate. But it is mostly, but not exclusively, the unvaccinated who are getting and transmitting it. So let's look at some statistics on it. So this is from a slideshow that the CDC, the Centers for Disease Control, put together that was leaked to the media by someone. So slide 3 here summarizes some data about risks of disease, hospitalization, and death among unvaccinated versus vaccinated people here in the United States. So sort of a summary of the data that they had found that it was 8 times less likely for vaccinated people to get symptomatic COVID than unvaccinated people. It was 25 times less likely for a vaccinated person to require hospitalization versus unvaccinated people. And of course, the majority of people who are hospitalized live, but far more likely to die if you're unvaccinated. About 25 times as likely that unvaccinated people, who of course are typically hospitalized if they have that serious a case of it, to die compared to vaccinated people. Only in this study, or this, summary of data, 4 out of 1,000 vaccinated people versus 96 out of 1,000, 96 out of 100. Okay, let me make sure I'm doing the math right here. 1 out of 400 versus 1 out of 100 approximately. No. sorry, 1 out of 4,000, I'm sorry, versus 1 out of 100. Okay, let's look at some other data. An article on COVID-19 breakthrough cases, and this print's kind of small, so let me stick on my glasses here. So as we've just seen, COVID-19 vaccines are highly effective at preventing severe disease, hospitalization, and death from COVID-19. But also, the vaccines reduce the likelihood of mild or even asymptomatic infection. But a small share of fully vaccinated people do get infected, and some become hospitalized or even die. And these cases where vaccinated people get confirmed symptomatic infection or have more severe consequences than that are known as breakthrough cases. And they're to be expected because no vaccine is perfect. No other vaccine in history has 100% stopped people from getting infected with a disease. They just greatly reduce the likelihood. So this news outlet looked at the data from various states reporting breakthrough cases, which only half of the states report data on breakthrough events. 24 states provided data on, breakthrough infections, a vaccinated person testing positive for COVID. 19 of them provided data on hospitalizations and deaths. So the data reported from the states that they looked at indicated that breakthrough cases, hospitalizations, and deaths are extremely rare events among those who are fully vaccinated against COVID-19. The rate of breakthrough cases reported among those fully vaccinated is well below 1% in all reporting states, ranging from 0.01% in Connecticut to 0.29% in Alaska. The hospitalization rate among fully vaccinated people ranged from basically zero, almost zero cases in a number of states, to 0.06% of fully vaccinated people in Arkansas. So 0.06% of people, even in the state with the highest hospitalization of fully vaccinated people, were hospitalized. 0.06% of fully vaccinated people. In many states, no deaths among the states that had data were reported. In 2 states, Arkansas and Michigan, there was a death rate of 0.01%. And that was actually including people who might have died of causes other than COVID. So we're talking 1 out of 10,000 fully vaccinated people died of COVID. And as you probably know, COVID is much more likely to cause severe disease in elderly people than in younger people. So probably half or more of the fully vaccinated people who were hospitalized or died were people, senior citizens, basically. Because actually, statistically speaking, somebody who's vaccinated and 80 years old still has about the same chance of developing severe disease from COVID as somebody who's unvaccinated and, say, 40 years old. But that's not to say that there isn't a pretty decent chance if you're 40 years old or whatever, or younger than that, that if you just kind of go around willy-nilly and don't make any effort to protect yourself from COVID, you'll probably get it, and there's certainly a decent possibility that you'll get seriously ill. So, in summary, almost all, more than 9 in 10 COVID cases have occurred among people who were unvaccinated or not yet fully vaccinated, and even higher, even lower proportions of people who are hospitalized or die are unvaccinated people. The reported share of COVID cases among those not fully vaccinated ranged from 94% in Arizona to 99.85% in Connecticut. The share of hospitalizations among those with COVID who aren't fully vaccinated ranged from 95% in Alaska to 99.9% in New Jersey. And for deaths, it was from 96.9% in Montana to 99.9% in New Jersey. The percentage of people who were not fully vaccinated among those who died from COVID. So objectively speaking, then, no, you can't say that it's a pandemic in unvaccinated in an absolute sense, but you can't say that overwhelmingly it's unvaccinated people that are getting infected, and even more overwhelmingly, it's unvaccinated people who are getting hospitalized or dying. The evidence is pretty clear on that. So you might wonder, well, what about transmission? Granted, we have evidence that suggests that, vaccinated people are much likely to get COVID, and if you don't get it, then you can't pass it on. But what about vaccinated people who do get it? I've heard that vaccinated people can pass it on, and I heard about this study where they found that they had similar viral loads to unvaccinated people. What about that? Okay, well, let's see if those things that you commonly hear are actually true, and look at what we know about how likely it is that vaccinated people will transmit, get the virus and transmit it on to others. So, it's mostly unvaccinated people who are getting and transmitting it. As you see, their odds of hospitalization and death are much lower, even than odds of getting COVID for vaccinated people. But vaccinated people can get it and transmit it. There was a super spreader event in Provincetown, Massachusetts. Let's see, I thought I had an article about it here. Let's see. Okay, I don't appear to have saved it. Sorry about that. But anyway, I'll just tell you what I remember about this study, or the incident that was studied. Provincetown, Massachusetts is a sleepy little beach town at Cape Cod, in the Cape Cod area in Massachusetts. And they had some sort of festival there a few weeks ago, where hundreds of people attended. So there were big crowds of people. They were partying at bars every night. They weren't wearing masks. There was no mask mandate. A pretty sizable majority of them, I think I read something like 70%, or 75% were vaccinated. And yet, out of several hundred people who, well, I don't know how many people were there, but anyway, what I was going to say is several hundred people were infected with COVID, and most of the people who were infected were fully vaccinated. So, like, yeah, I think it was about 70% of the people who were infected, several hundred people, were fully vaccinated. So people were like, whoa, the vaccines don't work. But, you have to remember, the way vaccines work is they don't put like this force field around your body that keeps viruses out. They don't do that. If you're around, infected people in a space where, it's not outdoors, so, the virus isn't going to just dissipate, around you, the virus is going to come into your body. The studies that people have done on transmission of COVID have shown pretty clearly, or studies of just how water vapor dissipates in an enclosed space without good ventilation. They show that transmission of COVID is through little tiny water droplets, most of the time, that just kind of float around in the air and stay up there for a while. And also sometimes in bigger droplets that fall to the ground rapidly, but you happen to be in the path of someone speaking or sneezing or coughing or whatever, and it gets on you. But it can also linger in the air and infect you that way. So if you're vaccinated, the vaccines have prepared your immune system to fight off the virus better. But it doesn't mean that the virus won't get into your body and start multiplying. It just means that there's a better chance that your immune system will be able to kill off enough of the virus so that you don't get even an asymptomatic infection. Or if you do get a symptomatic infection, it'll pass more quickly and be less serious on average than if you were not vaccinated. But it doesn't stop you from getting infected. Like if you're in if you go into a crowded bar and there's several people around you who are infected with COVID, even if you're vaccinated, but you're not wearing a mask, there's a reasonable chance you could get it. Similarly, if you walk unmasked, even if vaccinated, into a COVID ward, and stay there for a little while, you're probably going to get infected. So, the point is, vaccines can protect us, but they don't work 100% of the time, and the more you're in settings where there's a lot of infected people around and you're in an indoor space with poor ventilation, the more that's the case, the more likely it is that you'll wind up with a breakthrough case of COVID. So that was happening. That's what was happening in Provincetown, Massachusetts, is that you had these crowds packed into these small enclosed spaces who weren't wearing masks or anything. And since a vaccine isn't, gonna turn your immune system into this magic force field that keeps that keeps the virus out of your body, all they're doing is stimulating your immune system to help you fight it. But you can still get it if you're vaxxed. And that's especially true with the current variant that we have, the Delta variant, that's accounting for maybe 90% of the cases of COVID currently. So, going back to the CDC's slideshow, this slide is an estimate of how infectious the Delta variant of COVID is relative to other diseases. And so there's a pretty wide range of estimates here. The x-axis here is what's called the R naught value. Uh, R naught being just sort of the average across all situations of how many people the average person who's infected with a disease will transmit that disease to. So you can see here, flu is not that contagious. It's just contagious enough that it'll pass around, and you'll have a bunch of cases if people aren't in any way protecting themselves and are indoors a lot. This happens during the winter, until COVID came along and we all masked up and you weren't spending a lot of time in public indoor spaces. And so you see various types of flu there. Common cold is a little more infectious than most flus. SARS, polio, smallpox is an R of a little over 5. Excuse me. The original strain of SARS-CoV-2 was estimated to have an R naught between 2.5 and 3, which means on average, a person infected with COVID will pass the infection on to between 2.5 and 3 people, absent any mitigating measures like staying home if you're sick or wearing a mask and so on and so forth. Delta variant has an R naught estimated to be between 5 and about 0.8. You see chickenpox there, and the CDC at this time was saying Delta variant was as transmissible as chickenpox. That doesn't appear to be quite true in light of further data. But it's almost as transmissible as chickenpox. And, if you're older like I am, you almost certainly had chickenpox as a kid, before there was a vaccine for chickenpox. And, I forget which of myself and my 2 siblings got chickenpox first, but it was like that from one of us to the other. We were all almost simultaneously sick. We infected each other because chickenpox is extremely contagious. Well, the Delta variant of COVID is maybe not quite as contagious as that, but almost as contagious. And that's why, in spite of the fact that roughly half of Americans are fully vaccinated against COVID, we're having this enormous surge in COVID cases right now. It really is that infectious that even if only half the population is fully protected from COVID, you can still get a big jump in infections just in the half of the population that's not vaccinated, and to some extent in those who are. So, particularly given that we've had, sort of coinciding with the emergence of the Delta variant, kind of a letting down of people's guard. So, back in May, the CDC dropped the requirement for vaccinated people to wear masks in public indoor spaces. And what a lot of people, including myself, were saying at the time was, this is a huge mistake, not only because vaccinated people aren't 100% protected from getting infected, but the bigger problem was if there are no requirements, that if there's no checking whether or not people are vaccinated, and it's just kind of the honor system that you'll wear a mask if you're not vaccinated, and then if you are vaccinated you don't have to. Of course, what is going to happen? Anybody with any understanding of human behavior knew that what would happen was that a lot of people who were unvaccinated would be like, fuck it, I hate wearing masks, I'm not going to wear a mask anymore, and they would just go into stores or restaurants or wherever, bars, without wearing any mask, and spending a lot more time in public indoor spaces. So that was a recipe for disaster. And so, you have scenes like this in Chicago, a couple of weeks ago. Lollapalooza, a big music festival attended by an estimated 400,000 people. Here's a big crowd by the lake. They're in Chicago, packed together. And you remember, it's true that um, outdoors you're not as likely to get infected with COVID as you are indoors. It's not even close. It's like less than 100th the odds, according to epidemiologists. But if people are packed together like this, the odds of getting infected go up. But more importantly, these big crowds of people, when the music's over, they're more than likely, a lot of them more than likely are going to go to some bar or something where they'll be packed into an indoor setting. So we can expect that this will be a super spreader event. Even though I think they required people to be vaccinated to attend this. I'm not sure, but a lot of people were vaccinated at it. Probably not the case at the motorcycle rally, attended by a similar number of people, actually even more, I think, going on in South Dakota right now, which was a huge super spreader event, accounting for an estimated many thousands of cases of COVID last year. So that's why just a couple of weeks ago, the Centers for Disease Control revised its guidelines and suggested they didn't impose a national mask mandate. They probably should have, but they suggested that everybody should start wearing masks again in public indoor spaces, regardless of vaccination status. And a number of localities, like the county where I live in, Monroe County, Indiana, put mask mandates back into effect. So everybody, like if you go into the grocery store here now, got signs on the door, county ordinance, you got to put on a mask, regardless of if you're vaccinated or not. And if you look at the statistics on the number of cases that have started to occur since the Delta variant became the predominant variant, which, as I said, it's more than twice as contagious as, more than twice as contagious as the original strain of COVID. Almost, not quite, but almost as contagious as chickenpox. And there you can see the statistics on number of daily confirmed new cases over time in Florida, which, until recently was among the least vaccinated states. Now it's come up to be pretty close to the average as people have started to get scared of COVID, and more and more people are getting vaccinated there. But probably the more important factor with Florida, why they've had this enormous spike in cases, is that the Republican governor there, Ron DeSantis, or Death Santis as he's sometimes called, has gone out of his way to put roadblocks in the way of cities and counties in Florida imposing any sort of mask mandate or any other sort of public health measure to try and slow down the spread of COVID. It's almost like he wants people to die or something. So he's telling all these schools in Florida that the state is going to cut off salaries for state employees, for administrators and teachers and so forth, if the or at least administrators, if the county imposes a mask mandate where they require the students and teachers and other staff to wear masks. So no wonder. But if you look at the figures there, Florida was down around, 1,000 daily cases in mid-June, and now they're up to over 25,000 new cases a day over the last few days. So like a 25-fold increase in number of daily new cases. As you might expect, given that a lot of people are vaccinated, something like half of Floridians are vaccinated, a lot of them older people, because Florida has a huge elderly population. Even despite the high vaccination rate, daily deaths have gone up from an average of around 20 in early July to over 100 now. So like a 5-fold increase in deaths. And granted, it's not up to its peak in January of 170 or its peak last summer of approximately the same. Because there are a lot of vaccinated people, particularly older people who are the ones who would be quite likely to die if they were not vaccinated, or more likely to die than younger people. But even so, this is going to keep going. So we're even with half the population of Florida vaccinated, given the astounding rate of cases, which is more new cases of COVID developing than ever in the entire history of the pandemic, which gives you an idea of how contagious the Delta variant is. If you don't implement measures to keep it in check, like universal masking and social distancing of other sorts of some type, this is what you're going to get. So and nationwide, daily new confirmed cases have surpassed 100,000 for the past several days. Okay, there's deaths. Yeah. So, 110,000, 130,000, 105,000 yesterday or day before yesterday. That's compared to, let's look at the average. You got down to a low of about an average of 12,000 cases a day in late June. Now we're over 100,000, so almost a 10-fold increase in cases in the United States. Now, because a lot of people are vaccinated, deaths haven't gone up as much, but still, since early July, the daily death rate has more than doubled. And it is going to keep going up. So this is a serious spike that we're encountering. Hospitalizations are way up over the last month in many parts of the country. Many hospitals in low vaccination areas have several, as much as 10 times as many hospitalizations as they did earlier in the summer. Now, one thing people will say, I often hear this from people who are kind of into minimizing the impact of the virus. They'll say, well, look at how many fewer people are dying now. It's only 500 a day. Well, it's true that 500 a day is nowhere near as high as the 3,000 people a day that were dying from COVID back in January. That's still a lot of people. Multiply that by 365, see what you get. It's like 200,000 people over the course of a year if we kept this up. 500 people every day in the United States dying. So that would make it, once again, the third leading cause of death in the United States. Do we really want to stay where we are? 500 people a day who otherwise, in all likelihood, wouldn't have died anytime super soon. Even if they're elderly, at least they'll live a few months to a few years more if they don't get, COVID. They'll probably live, a fair bit longer. There's, been a measurable decline in life expectancy in the U.S. since COVID came along. A couple of years, reduced life expectancy. because of over 600,000 people dying. So, there's this contrast effect where people, compare the number of people who are getting ill or dying from COVID now to what was the case back over last winter. And they're like, see, the vaccine's working, not nearly as many people are dying or getting hospitalized or whatever as was the case then. Well, actually, it's not true in the parts of the country that are least vaccinated. And that's not the proper way to go about looking at this, to compare what's happening now with what happened a few months ago when things were a lot worse, because things are still, objectively speaking, terrible right now. 500 people a day or so is not a trivial number of people to be dying from a preventable disease, or often preventable. And people do the same thing when they look at deaths of kids from COVID. So over the course of the year and a half or so of the pandemic, about 500 kids under age 12 in the United States have died from COVID. Or maybe it's 118, I forgot. But anyway, not very many compared to, hundreds of thousands of people over 60 dying from COVID. Okay, but again, that's the wrong thing to do, to compare the number of deaths of children who don't really die of much anyway, right? They're expected to live well into adulthood. Life expectancy is about 80. So not very many young children die anyway, but 500 of them died, over the last year and a half from COVID, who wouldn't, likely would have died otherwise. That's not a trivial thing, don't minimize it. And in addition, approximately 5% of kids who are getting COVID, which they're just as likely to get infected with as adults are getting long COVID, which we talked about earlier. And more and more of them are getting serious cases of COVID and hospitalized because the Delta variant, which kids under 12 are not eligible to be vaccinated against. They're not eligible for the COVID vaccine yet. They're getting more seriously ill than people, even young people, were earlier in the pandemic. Delta does seem to be a little more severe, as well as a lot more contagious. Now let's see if I can show you. Yes, here we go. Okay. I did a little statistical analysis on a state-by-state level here to show you how much of an impact vaccinations were having. So, let's see. Okay, here's the one I wanted to show you first. Okay, so this is the a comparison of the 26 least vaccinated states in the U.S. To the 24 most vaccinated states, and plus D.C. So basically, the top and bottom halves in terms of vaccination rate. In terms of the number of cases of COVID per 100,000 people. And so, you can see right there, right underneath where it says descriptives and the column that says mean, for the half of states that had the lowest vaccination rate, 39 people out of 100,000 were infected with COVID. whereas in half of the states with the highest vaccination rate, only 15.6 out of 100,000 people were infected with COVID. If we break it down further and just look at the top 10 vaccination rate and bottom 10 vaccination rate states, you see a much bigger difference. So the bottom 10 vaccination rate states have about 50 cases per 100,000, as of August 7th. And FV Cat 716 is the number of people fully vaccinated in the state on July 16th. And the cases were as of August 7th, a few days ago, versus only 13.7 cases per 100,000 in the top 10 vaccinated states. So almost 4 times as many people infected with COVID per 100,000 in the less vaccinated states than in the more vaccinated states. And it wasn't like it was a huge difference in rate of vaccination. So on average, 36.6% of people were fully vaccinated in the 10 least vaccinated states. 59.5% of the population was fully vaccinated in the 10 most vaccinated states. So 23% difference. So it wasn't like 10% versus 90 or something like that. We don't have that big a discrepancy. But still 23% difference in vaccination rate resulted in a 4-fold difference, approximately, in infection rates. So that's really pretty huge, I think. Now, we wouldn't be in this predicament if there weren't so many resistant to getting the vaccine, and we had, say, 80% vaccination instead of just under 50. And understandably, that's created a lot of resentment toward unvaccinated people on the part of vaccinated people. As I showed you earlier, even a doctor in Alabama who's sort of trained to just take care of everybody, be equally compassionate and caring toward everybody, had to check her initial impulse to harshly judge the unvaccinated people who overwhelmingly were who was showing up at her hospital infected with COVID. And as she recognized, it's not really fair to look at it that way, because for one thing, let's get back to where is it? No, don't tell me I can't. Oh, here we go. There it is. Okay. All right, so as we've established, it's technically correct to say that COVID-19 is, as Rochelle Walensky, the CDC director, said, becoming a pandemic of the unvaccinated. That's technically correct. Some, but not most, of the people who get infected with COVID are vaccinated. Even fewer who get hospitalized are vaccinated. It's overwhelmingly unvaccinated people who are getting hospitalized, getting seriously ill, dying, infecting other people. Which, oh, by the way, I guess I should just quickly mention data that we have on infectiousness of people who are vaccinated and who get COVID. Of course, as we've already talked about, if you are vaccinated, you have a much lower chance, although far from zero chance, of getting infected with COVID, but it's much lower than if you're not vaccinated. So if you're not infected, you can't pass it on. But the question is how contagious, how infectious are people who are vaccinated who get COVID relative to people who are not vaccinated. And initially, there were reports that people who were vaccinated and infected with COVID had similar what are called CT levels to people who were unvaccinated and infected with COVID. Let's see if I've got that information here. Oh, here we go. So the CT or cycle threshold value is basically just an index of how much viral genetic material is present in a specimen taken from a patient infected with COVID. And so there was one study that found similar CT values in people who were vaccinated versus and infected with COVID versus unvaccinated people who were infected with COVID. And folks were like, aha! So a similar amount of viral genetic material is in vaccinated people who have COVID and unvaccinated people who have COVID. So, it looks like they're about equally infectious. Well, there's several things wrong with drawing that conclusion. And I've talked to virologists about this, and they've said that. As the CDC says, CT value should not be used to determine a patient's viral load or how infection a person is. Because there are a lot of factors that affect that value, which basically is a measure of how many times you have to do what's called amplification with the specimen to create a certain number of copies of the virus. And so specimens with lower amounts of virus will require more cycles to amplify that genetic material to reach an amount that can be detected. So they'll have a higher cycle threshold value. So it's correlated with infectiousness, right? Because more viral genetic material, you would think that would be associated with how infectious a person is. However, so a lower CT value means more viral material. But a couple of things to keep in mind. One, there are a lot of factors besides the amount of virus a person has that can affect the CT value. And secondly, when they're testing for how much viral genetic material is present, they're not measuring whether those viruses are alive or not. And a dead virus can't infect you with COVID, right? So, just because vaccinated, unvaccinated, infected people have similar CT values doesn't necessarily mean they're similarly infectious. The vaccinated person probably has more dead viruses in the sample, and also, if you measure over time, because their immune system is doing a better job of fighting the virus, their levels are going to drop quicker, and they're going to get over COVID faster than a person who's unvaccinated. Just on average, right? Not in every case, but on average. And another thing to bear in mind is that these samples of people are not comparable. Because people who are vaccinated are less likely to get COVID in the first place. If they do get infected with COVID, they're less likely to have a symptomatic case that's likely to be tested for, and they're going to have a lower viral load, so they're going to be less infectious. And we don't necessarily know whether they have it or not. It's true that asymptomatic people can pass on COVID, but asymptomaticity, if that's a word, is related to how much virus is in your system. And so you're less infectious prior to developing full-blown symptoms. You may still be infectious, but less so. So in any case, to make a long story short, it's likely that even COVID positive vaccinated people are less infectious than their COVID positive unvaccinated counterparts. And scientists that I follow on Twitter, oh, that's the wrong one. Let's see. Yeah, here we go. Hurry up, please. I do not get this. Okay, here we go. A scientist that I follow on Twitter did a Twitter thread talking about some new research out of Imperial College London, finding that fully vaccinated people are 3 times less likely to test positive for SARS-CoV-2 than unvaccinated individuals. Okay, we knew that. And are less likely to pass on the virus to others due to having a smaller viral load on average and therefore shedding less virus. Okay, so well, back to the point I was making about who unvaccinated people are. This is something that, in the interest of time, I'm going to have to be very brief about right now and talk about it later. But only a small percentage of unvaccinated people are hardcore anti-vaxxers. And bear in mind that probably the largest group of unvaccinated people are kids under 12 who are not eligible to be vaccinated. That's like 25 million people, or what would that be? That would be it would be the largest group of unvaccinated people there are. People who simply aren't eligible for it. And of course, kids under 18, but older than 12 or older, they're eligible for the vaccine, but in most cases they live with their parents. Maybe their parents are anti-vaxxers or are skittish about the vaccine, so therefore the kids can't get it. And of those vaccinated, 12 to 17-year-olds do have the lowest vaccination rate. We know that. So it's really not their fault. Well, what about adults? Even there, only a minority of adults who are not vaccinated are people who are hardcore anti-vaxxers who would never ever get any vaccine whatsoever, and they believe all sorts of things about vaccinations that are not scientifically valid about not only the COVID vaccine but any other vaccine. And then there are people who specifically are opposed to COVID vaccines, although from what I see, they seem to be in particular opposed to the mRNA, messenger RNA COVID vaccines, which rely on what's called messenger RNA to stimulate our body to produce spike proteins that look like those that the coronavirus has, and so that stimulates our immune system to mount a protective response that then carries over, and a protective response is then mounted when the actual coronavirus shows up, which basically just a different and novel way of stimulating an immune response to a virus, so that your immune system can fight it off better. So people have argued, this is a very first vaccine, the Moderna and Pfizer vaccines, two of the three that are available in the United States. The third being the Johnson & Johnson vaccine, which is not mRNA technology. But anyway, they say, well, it's new and untested. How do we know it's safe? Well, that's a subject we can go into more detail on some other time. But basically, all vaccines that are available here in the United States currently, and in most countries around the world, are under emergency use authorization, or the equivalent in that country, meaning that there's not as much data on them as there would be if they were fully authorized. But at the same time, you have to go through several steps, clinical trials, in order to acquire emergency use authorization for vaccines or any other drug in the United States. And it's a pretty extensive process. 3 sets of clinical trials, where the third one, in the case of the vaccines, or really any vaccine or any medication, the third clinical trial involved tens of thousands of people. Either randomly assigned to either receive the vaccine or not receive the vaccine, and then they go about their daily life, and then at the end, a couple of months later, they measure how many were infected who got the vaccine versus got a placebo, which they aren't told right away if they got the actual vaccine or not. And overwhelmingly, the people who were actually vaccinated have been far less likely to be infected with COVID than the people who were not vaccinated. So we know it works pretty darn well at reducing infectiousness, at least against the variant that was prevalent at that time. And now there's later research that shows that the vaccines also substantially reduce infectiousness, but even more so reduce hospitalization or other bad outcomes, even with the Delta variant. Very few cases of serious side effects were found in these clinical trials. Since the clinical trials of these and other vaccines around the world, roughly 4.5 billion doses of vaccines have been given to people, with roughly half of those, around 2 billion-ish doses of the Pfizer and Moderna vaccines, the mRNA vaccines that are produced here in the United States and also in Germany, in the case of Pfizer. Roughly 2 billion doses of these two vaccines given. Only very rarely have people suffered serious side effects. Their safety record so far has proven to be even better than the safety record for some vaccines in the past. And with the exception of the live virus polio vaccine, there really haven't been any serious safety issues with vaccinations in the history of using vaccines. And so far, about 8 months after the COVID vaccines, or at least the first two, started being administered en masse in the United States, that track record of being highly efficacious at reducing the likelihood of infection, serious illness, death, etc., infectiousness, and of being relatively safe. No medication is risk-free. They all have side effects. Fortunately, most medications that we use, including vaccines, rarely have severe side effects. In any case, back to the point I was making, unvaccinated people are not a monolith. Only a minority of them are hardcore opposed to vaccines. So, especially after at least two of the three vaccines available to us here in the United States are fully authorized, probably sometime within the next couple of months. A lot of the people who haven't gotten vaccinated yet, will probably get vaccinated. They'll probably uh, be less hesitant once that happens. Okay, I've gone on long enough here. Over an hour. So you know, again, I just want to summarize, the basic conclusion here, which is that yes, it's the case that the vast majority of people getting infected, and even more so getting serious disease from COVID, are unvaccinated people. You know, well under 10% of the people who are getting infected are vaccinated people. As far as people who are hospitalized or die, um, it's like under 1%. And particularly with deaths substantially under 1% of the people who are having these really serious consequences from COVID are vaccinated people. So, vaccines seem to be working pretty well at reducing the likelihood of COVID. And if a lot more people get vaccinated, and if we take other public health measures, because things like masks, especially high quality masks, because N95 masks work a lot better at keeping the virus out and keeping it in if you're infected than lower quality cloth masks, which is not to say that the latter don't help, but get a good mask and you'll protect yourself better. So next time I want to get into talking about just these different categories of unvaccinated people, and like how they come about, or how they develop the ideas that they have about the vaccine and or vaccines, and like who are the hardcore anti-vaxxers? Because as it turns out, I'll just briefly say here, a lot of them are making a ton of money off of pushing this hardcore anti-vaccine message, and have been for many years. Joseph Mercola, for example, one of the most successful people in the anti-vax crowd, is worth about $100 million. He has a best-selling book right now on Amazon. He has this huge sort of conglomerate that he's the main owner of, that puts out so-called alternative treatments for various diseases, and through that and books and videos and so forth, he's made a fortune off of this, and so have quite a few other people who are pushing the anti-vax message. And next time what I want to do is look at just what sorts of messages anti-vaxxers are promoting, and what impact are they having on public discourse. So stay tuned for that, and hope you have a good rest of your day, and I will see you next time.